Hi, everyone. Welcome to the Eczema Warrior podcast. Today, we have a guest speaker on. I'm super excited. We have Trista Chan, who is a registered dietitian and hormone health expert specializing in PCOS, gut health, and women's health. She blends evidence-based clinical nutrition with intuition to help individuals heal both their bodies and their relationship with food while actively working to destigmatize periods and reproductive health. Trista is also the host of the Joyful Eating for PCOS and Gut Health podcast, where she shares practical tips on nutrition, hormones, and digestive health. I am so honored to have Trista on today to talk all things about PCOS. Trista, welcome to the show.
Thanks, Julia. Thanks for the warm welcome and such a nice intro. It's so nice to, hear that about yourself. We just we're in our own little offices, working our own businesses. So I'm like, oh yeah, I'm being perceived by other people.
Amazing. Yeah, super excited to have you on to talk about PCOS today. So that's going to be our main topic is to talk about PCOS, how to manage it, root causes, nutrition, just basically I'm going to be picking your brain. I feel like the hormone world, a lot of people are really confused about what to do, how to manage it. Like hormonal health can be really confusing. So I'm excited to bring this topic to the audience.
I totally hear you. It's on the one hand, it's a really trending topic right now. And that makes me really happy, right? As someone who, we're both women, women's health historically has been underrepresented, under-researched, right? So now it's finally front and center, but it's still so misunderstood. And there's so many myths out there. I'm really happy that you invited me on. So thank you for sharing your platform.
So why don't we start off with telling us about you and your story in becoming a registered dietitian and why you decided to specialize in hormone health?
So thankfully, I'm one of those people that I think I can proudly say that becoming a dietitian was something that, always known, has been somewhat my calling, so to speak, right? So I remember, being in Ontario, I don't know what it's like in BC or British Columbia, but we have grade 10 careers class. So you sit in class, and then I remember being 15 and doing those little silly quizzes, telling you what your career should be. And I remember dietitian was one of the top 5, and I was like, of course, that's what I'm going to go to school for. And that's mainly because growing up, food is such a big part of my culture. Right. So as a Chinese Canadian, maybe you can relate as an East Asian person or many cultures around the world, is that food is something that still to this day is just a way that my family shows love and support. And so many of my favorite moments with the people I love most and my community members are centered around food. So it's a beautiful vehicle to show nourishment, to show, support and connection. And I really see the value in that. So I went to school, became a dietitian, really have loved food along the way. And knowing that coming from a Chinese background, my parents, particularly my mother, practices a lot of traditional Chinese medicine and those healing practices. In Chinese medicine, for women's health, it is so centered around periods and hormones. I can't even tell you, from day one, I got my period in grade 6. Right? I remember the day, literally since then, every single month, my mom asks me about my period to this day. My grandma asks me about it. It is just such a proxy, I think, for women's health overall. So that really triggered my interest, and it's always been something that I've been very, very aware of. So growing up, now as a dietitian, now that I've gone through the whole, quote unquote, clinical knowledge, learn the evidence and the science and pathophysiology, I've really combined that with my own lived experience, but also those of my clients, right? And my goal is really to just support people to, one, feel good around food, be able to nourish their bodies while also still preserving that joy of eating, and two, also help to support any hormonal imbalances to the best that nutrition can, right? Because it is one of those tools that for many people are at least somewhat modifiable. So it's really combining that Western and Eastern lens, that allopathic with and traditional with more, quote unquote, evidence-based healing practices in my practice. And I love, love, love working with patients with PCOS, because I find with PCOS, this population in particular can benefit so much from that lens.
I love this so much because I feel like, I don't know if you noticed this too, but how we were trained as dietitians, it's always been so Western and conventional.
Mm-hmm.
But with private practice, as we're seeing more patients and clients, we actually see that there's a big importance with Eastern medicine and holistic approaches. And you've obviously probably seen it in practice, like how
Mhm.
impactful and helpful and effective for your clients in combining both, right? The Western and the Eastern.
Yeah, for sure. And there's so much, like, I feel like an undergrad in particular or master's, like, yes, it's important to do evidence informed practice. And that's a whole other conversation, the wild, wild wellness
Yeah.
world. But really integrating the two, there's a lot of unlearning that also has to take place to actually create space to honor those lived experiences and those traditional healing practices that actually make people feel better mentally, physically. And I am of the practice or the belief that both can go hand in hand, right? It's not either or.
We see that in practice too. It's good to have a combination of both. And sometimes the
Yeah.
patient needs it,
Yes.
right?
And I think
Yeah.
a lot of people are seeking that too these days, right?
Yeah, exactly, which is amazing
Yeah.
for us because we're learning how we can use our own bodies to heal from symptoms.
Yes. Yes,
Yeah.
exactly. And on that note too, like an extension of that, I find so much of my work is actually getting people to reestablish that mind body connection and
Ooh.
that interoceptive awareness and really bringing them back to the basics of those universal principles of healthy living, of physical health, nourishment, mental well-being, self-care.
So, why don't we dive into the topic now
Mhm.
that we have a little bit of an introduction about you and why you became a dietitian and specialize in hormones? Can you tell our audience what exactly is PCOS? What does it stand for? What is it exactly?
Yes, so PCOS stands for Polycystic Ovary Syndrome, which is an endocrine disorder that is characterized by typically high levels of insulin, so insulin resistance, inflammation, irregular periods. And we can talk about the diagnostic criteria soon, but I think right off the bat, I want to bust the myth that PCOS is only important if you want to get pregnant, right? So for so long, it's been positioned as just a quote unquote infertility issue. So many patients will come to me and they'll be like, well, I was diagnosed with PCOS when I couldn't get pregnant, or I was diagnosed when I was a teenager or, in my early mid 20s, but I was told to come back when I want to get pregnant. But in reality, PCOS is a significant public health issue, in my opinion, right? Because it has not just reproductive, but cardiometabolic, dermatological, psychological features. And it's a wide ranging impact on health too that's often oversimplified. Some with PCOS essentially in like colloquial terms, like endocrine disorder, think of it as just hormone imbalances. The day-to-day challenges can include things like excessive body hair, acne, intensive cravings, fatigue, mood swings, hair thinning, missing period,
Mm.
painful periods. But beyond that, long-term, there are increase in risk factors. PCOS should be taken seriously, right? Because it increases the risk for type 2 diabetes, for heart disease, endometrial cancer, because guess what? If you're not shedding your uterine lining every month, that uterine lining thickens and actually increases the risk for endometrial
Mm.
cancer and mood disorders too. So I'm just really driving home that point that PCOS care is urgently needed because they estimate about 10%, or data suggests that 10% of the population that it is in reproductive years, so women or people with ovaries, actually have PCOS. So that's like 10 people in a room, one of you is likely to have PCOS.
Oh my gosh, do I have PCOS?
Yeah, yeah. So that said, those are the worst of the worst of the symptoms and the risk factors, right? Let's say if the PCOS is maybe in a more severe form, right? And it comes with several other comorbidities. I've also worked with many patients who thrive with PCOS who maybe got diagnosed, there was screening and testing, but their periods are somewhat regular, their energies are somewhat balanced, right? So there is that large spectrum as well. But my main point is that I just want it to be taken seriously, right? And not just seen as, oh, women should be normalizing, like, oh, everyone has period problems.
Mm.
That's a tale as old as time, that alone.
PMS, that's
Yeah,
normal.
right. Like, just
Yeah.
live with it. Like, no, you don't necessarily have to suffer in silence. There is a lot of treatment approaches now for PCOS. There's a lot of support communities available. There's a lot of providers who are trained in both approaches to support.
And bring awareness to it as well.
Yeah.
Oh, there's so many things I want to like start jumping into. You mentioned these symptoms. Do you have to have all of them to start suspecting that you may have PCOS, or can you just have one? Do you have to have missed periods and you lose hair?
I can talk a little bit about how it gets diagnosed, regardless whether there's a diagnosis or there's not, or there's suspected, or maybe there's just a few symptoms. I like to take the approach of treating the symptom, right? the clinical symptoms and taking that personalized approach. With diagnosis, let's say you suspect you have PCOS, you go visit your doctor. This is the criteria they would use to diagnose it. It's called the Rotterdam criteria. It requires at least two of the three things. One is hyperandrogenism, high levels of androgens, aka male sex hormones. This can be shown through either blood work, so biochemical, or through symptoms, that's clinical, like cystic acne, excessive hair growth, particularly on the chin, the face, or scalp hair loss, as well dark patches of skin. So those are clinical signs. Number two, irregular or absent menstrual cycles, also known as ovulatory dysfunction. And number three, actually seeing excess amount of follicles on the ultrasound, or having your blood work show higher levels of AMH. So that's anti-Mullerian hormone. That's a marker for ovarian reserve. 2 out of 3 of those criteria, right, according to the international evidence-based guidelines for assessing and managing PCOS, is needed for a diagnosis. And this is more only relevant in adults. In adolescents, it looks a little bit different. So let's say you're like, okay, my periods are irregular, right? Oh my gosh, do I have PCOS? But there's no other signs. Usually from a nutrition, like a clinical nutrition perspective, I would look at not necessarily treating it as if it were PCOS, because there's so many things that impact our hormones too, right? Like,
And your period.
are we under fueling? Is this a case of maybe hypothalamic amenorrhea, right? Are we eating adequate fats and calories for actually our reproductive function to be working? Because if not, guess what? Our body, it's on our side, right? It's really just there for survival. So it's going to shut down reproductive functions, right? That would be suspected. That said, I have many of my patients have really just gone through so much self-advocacy for years to get proper diagnosis and treatments. And then working with a registered dietitian or other health providers that give more lifestyle support and holistic support, that can change wonders regardless of hormone status.
So it sounds like even if you don't have an actual diagnosis for PCOS, because it can actually be difficult to, I guess, first of all, have your doctor be willing to do testing, but also like your hormones can be impacted by so many different factors too. So it's combining the diagnosis if it's there, and then with clinical assessment, looking at the nutrition and lifestyle as well. Is that kind of how you would address someone with potentially PCOS?
Exactly. So regardless of whether or not, right, there's that, let's say, formal diagnosis, or maybe that person actually doesn't have PCOS, but they have like high androgen. Doing an assessment, I would look at, okay, still the same things, like what are you eating? Is it enough? Are your blood sugars stable? Are you taking supplements that are going to support regular testosterone levels? What's your relationship with food like? What's our stress management like? Are we eating adequate protein, building blocks of our body? How do you manage stress load on your body? I am so passionate about PCOS, but also there's a whole spectrum of hormonal and reproductive disorders that can still benefit from an approach that's informed by both those holistic and traditional.
Just looking at the person as a whole. I know you mentioned some of the root causes of PCOS. You mentioned insulin resistance. What are the main root causes of PCOS that you see in your practice or in general?
Oh my goodness, such a good questions. You might be thinking, oh my, why do I have this condition? So first and foremost, I want to say for anyone who's listening is just know that you can't eat or not exercise or stress yourself into it. It is caused by a interaction between genetic and environmental factors. That said, lifestyle can, we suspect, trigger or activate it. So for example, a lot of my patients, after a period of chronic unmanageable stress, then there's flare-ups, they go through the whole process, you get diagnosed. But before that, there's high family clustering. There's maybe an aunt, a cousin, a mom who has type 2 diabetes. Maybe there was exposure to endocrine disrupting chemicals throughout the entire lifespan. Those are the risk factors, really genetic, environmental exposure, and then more so the lifestyle can either trigger it or exacerbate it to have a major flare up. And I say that not to like disempower people. I don't want to be like, oh, there's nothing you can do to change it, but also it's not your fault. It is not a product of what you didn't do or what you did do, but knowing that as well, it's not all doomed. There are things within your power that you can take charge of to stabilize blood sugars and increase insulin sensitivity, to reduce inflammation, to restore your nutrients, to support your nervous system, to support your gut microbiome. All these things are going to help you feel better. It's going to lower your risk for developing the chronic disease. It can absolutely help regulate your period. It can help with mood stabilization, with energy, and it can only help, right, with adjusting nutrition.
It's like eczema too. A lot of it is people are born with eczema in their genetics. Like it's in my genetics. It sucks, I guess you kind of say it, but there are lifestyle changes you can make to prevent massive flare ups from happening. And that's just making changes to your nutrition and lifestyle. And that is like epigenetics, right? You can't change your genes, but you can alter the regulation of the gene, which helps with preventing flare ups. You talked a little bit about the diagnosis of PCOS. For my audience, anyone who's tuning into the episode, if they suspect that they have PCOS, what are their next steps? What exactly would they want to ask their doctor, for example?
I would suggest tracking your symptoms first and foremost. And think of that as part of the advocacy, is bringing like, hey, this is data, this is evidence. I have like cold hard facts if that's what you need. If you don't care about my lived experience, right? Track your cycles, get as much as you can. When they come, are they 30 days? Are they 50 days? Are they 70 days? Track your mood when your period comes, how heavy, medium, or light your flow is, how many days it comes. Take photos. If you experience cystic acne, especially during different times of your cycle, note your bloating, right? And you can bring this to, let's say, your physician or healthcare provider and say, hey, this is actually how I'm feeling and how it's fluctuating day to day. This is how energy's low, my mood's changing, and these are some lab work. Can we run some tests? Maybe I have a family history of type 2 diabetes, my period's delayed. I'm suspecting maybe I have PCOS. And this is what I actually advise to a lot of clients or inquiries, is that I actually, shameless plug here, I do actually have a free symptom tracker and a free labs checklist just for this purpose that has it all neatly down in a chart. So for 30 days, you can write down all your symptoms, and there's actually a checklist that you can bring to your physician. Usually, I would recommend testing for full blood sugar, fasting sugars, A1C, and fasting insulin, and that can help determine if there's elevated sugars or early signs of insulin resistance. So we need to look at fasting insulin in ratio with the fasting glucose, so you can see what your blood sugars are and how your insulin's actually responding. So that can be an early sign of insulin resistance, which is present in 70% of people with PCOS, regardless of body size. Lipid panel, I'd also look at, because there is that higher risk for heart disease with PCOS. And then, of course, male sex hormones, testosterone, DHEAS, seeing if those are quote unquote within range, looking at B12, ferritin levels, vitamin D, B12 in particular, common deficiency in PCOS, and then inflammatory markers, specifically C-reactive protein as well, because for many people with PCOS, there is oftentimes a chronic low-grade inflammation that occurs. I find most doctors are quite receptive, I find, to patients who are advocating for themselves and are actually increasingly aware and really, really well informed on PCOS and has a really great medical treatment plan. It's more so, for me, there's often that gap between triaging or referring patients to lifestyle support. A lot of people, compared to, let's say, when I started this practice 6 years ago, are getting diagnosed, monitoring in some way, but now it's time to work with someone to adjust the nutrition and not just throw them on a random low carb diet and like refer them to a professional. If you're someone who is listening and you suspect you have PCOS, right, track your symptoms, request some lab work, and your doctor will likely know where to go from there. You can review the Rotterdam criteria, right? Maybe discuss with your doctor what your clinical symptoms are, and those are some ways that you can investigate. If you're someone with PCOS, and especially if there's irregularities or you have like flare-ups of symptoms often, test your blood work every 6 months to monitor that closely.
You want to be able to go to your doctor and have things to share, right? Symptoms, how you've been feeling, your history. And we do have to be our own biggest advocate, because when we're not and we say a couple things, they're like, okay, it doesn't sound too severe, you'll be fine kind of thing. So it's important to have like it written down or something and documented, like you mentioned. When you go to your doctor, it's an easier conversation without feeling like, oh, I need to like look back and see when and how I've been feeling. So I would love to talk about when you mentioned when patients are diagnosed with PCOS, you've noticed in the last few years, it's been getting a lot better with the diagnosis from doctors. Now, the challenge is the actual approach. The conventional approach versus the holistic alternative way of managing PCOS. What are the challenges? Do you often see, I have one particular question, is the prescription of medications like birth control, for example?
What I often see, and this is not to say all, right, but a lot of patients have expressed to me from their own histories, is they struggle with irregular periods, cravings, maybe unexplained significant flare-ups, clinical manifestations, and they were diagnosed, maybe put on metformin or birth control and sent on their way. To be clear, actually, there are benefits of birth control. I just think of it as a band-aid solution. There actually is a myth. I had Dr. Laura Von Hagen. She's a naturopath who works with a lot of PCOS patients here in Toronto on my podcast a few months ago, and we had a really deep discussion around the myth of birth control causing PCOS, and that is not the case. But a lot of times people will take birth control for like 15 years, they get off, they don't get their periods, and they get diagnosed. So it's not that birth control causes it, it's more the masking. And then that band-aid solution of, here, let me check mark off on your way. You don't have to make any other adjustments or changes. There's no lifestyle support. There's no any of that. There are reasons why someone want to take birth control, whether it's to support with regulating menstrual cycles, whether it's actually for the use of birth control too, right? So it's something that often gets missed in the conversation. Maybe you don't want to get pregnant. And then metformin is also commonly recommended, mainly for managing metabolic outcomes, not so much like hormonal imbalances or the high androgens. It's more insulin resistance, glucose, lipid profile as well. I think regardless of whether or not you choose to take medication, addressing nutrition, lifestyle, mind-body connection is first-line treatment or part of first-line treatment because it plays a very direct and crucial role in insulin sensitivity, in inflammation, in reproductive function, but even just like baseline every system in your body, right? Like literally every single one from like a functional perspective. And there's so much research. Even without that research, like I'm such a believer in the power of like
Your body.
nourishing yourself and your body, right? And reconnecting. We live in a world where it really separates us from how we feel, our bodies, our internal cues, working on things as simple as regulating our meal timing. Don't be afraid of eating. That directly has an impact on your blood sugars and insulin levels. Those are windows of opportunity to incorporate so much nourishment for all of your cells. It's about balanced meals, using foods that you can access. So being Chinese, like so many of my patients, and myself actually included up until my master's, I literally thought Asian food was unhealthy, like, which is crazy, right? No, it's not.
I
Like,
thought that
and
too. So oily and fatty.
right? Meanwhile, everyone's like talking about like the most Americanized versions. So it's about embracing the foods that you grew up with, whatever culture or meaning it has to you. It's about reconnecting with your body, regulating your nervous system, finding movements that you like. So we're not chronically stressed. And guess what? Androgens, yes, are produced in our ovaries, so the insulin resistance can cause overproduction of androgens, causing high testosterone, but also it's produced in our adrenal glands, which is where stress hormones are also produced. Stress management or building our stress resilience comes, right? It's how do we look at our diet and incorporate more anti-inflammatory nutrients? There is so much power in gentle nutrition and reconnecting with our body too. This is like unlocks a whole world of healing for patients with PCOS and hormone imbalance beyond the prescriptions.
Do you guys hear that? How important nutrition is? I'm repeating that because a lot of my listeners, they unfortunately, it's not their fault. They tend towards avoiding foods and restricting their diet to heal inflammation, to heal their hormones, to heal their eczema. So I'm constantly also trying to bring the awareness how important your nutrition is. There's so much noise outside as well, right? Like you have to intermittent fast and you should be doing these 7-day fasts. It's good for you. Like misinformation about nutrition. So it's so important to learn from an expert who has seen client cases of people improve from some of these strategies and recommendations you're giving.
Yes, there are some wild diets out there. And I'm like, in what world is not eating enough nutrients gonna help your body, right? As you can imagine, there's so many wild things for PCOS because like carbs, blood sugars, a lot of our work is also like demystifying, removing food fears, and actually giving people like true morality removed knowledge. For example, this is what a quick carb does. It gives you energy, but it gives you quick energy. So it's going to be high and low. How do we extend that energy life? With PCOS, it's important to have longer, sustained energy, right? So it's really taking away that good, bad. We talk about nutrient density. This makes us strong. This gives us short spurts of energy, right? So it's really, I think that language around how we talk about food is so, so important too.
Because then that's your relationship with food. Well, everything is bad, then you'll always see most food as bad. And if you label foods as good, then you might be hyperfixated on what good food is. I want to ask you a few more questions about diet, specifically for PCOS, but I have this question in the back of my mind and I want to ask before I forget. A lot of my friends actually are on birth control for reasons outside of preventing pregnancy. They take it because it helps regulate your period. And some of them also think that it's okay not to bleed. Have an IUD in, or they take birth control because they don't want to have their period. Can we please have your insight on this?
When I'm treating, let's say, a patient on long-term usage of IUD or birth control, my main concern from a nutrition perspective is, are there nutrients depletion? For example, as the case with many medications, like B vitamins tend to be depleted. That's so important for energy production. Things like magnesium, zinc as well for immunity. So a lot of my work is centering, okay, how do we nourish ourselves to ensure that there's no depletion of these nutrients? If you're ever in a phase of life where you want to discontinue, there might be a few months where it takes time to regulate, but how do we set our bodies up so that I can ovulate again? Nutrient repletion. That said, with some hormonal birth controls, going back to what I said previously around PCOS, not shedding that uterine lining, that thickened endometrial cancer, from my understanding, some hormonal birth controls actually keep that uterine lining thick. So it doesn't have that build up and then that increased risk for endometrial cancer, to my knowledge. There's those common like side effects or risk factors that usually the doctor would discuss as well. So things like blood clots. It's a personal choice. I know periods are very loaded for many people. Emotionally is complex.
I know we talked about diet, like diversity, balanced meals. Is there anything else that you wanted to share in terms of diet and PCOS that the listeners would appreciate learning more about?
So I just want to address, because you said intermittent fasting earlier, I usually don't recommend patients, and I'm just going to say intermittent fasting and keto and name those two because I see that prevalent, really, really high with PCOS population, is eat your breakfast. Don't do any fasted workouts. That's stressful on your body, stressful on your hormones. Fuel protein-rich breakfast. If you want a little bit of a time gap, I'd rather you shift your meals earlier in the day. Ensure you're eating adequate protein, yes, adequate fats, and then fibers with complex carbs too. I usually recommend higher amount of omega-3 fatty acids just to support that reduction in inflammation as well. If there's that acne, I know you work with a lot of skin health, so I'm sure you recommend a lot of omega-3 for skin too. So meal timing, anti-inflammatory eating pattern, and then for supplements. Now, the international guidelines recently actually recommended or added inositol for the purposes of hormone balance. And inositol is something that I've personally long recommended for patients with PCOS on a case-by-case basis, but I will say it's one of the more frequently recommended supplements. And basically, it's a B vitamin derivative found in foods, but in a higher therapeutic dosage that may help increase insulin sensitivity. It is linked with regulated periods and reduced androgen levels too. Back to what I said about the spectrum for patients, right? If someone has a mild PCOS and they're just looking to optimize their diet, I'm not going to recommend it right off the bat as like a protocol. But if, let's say, a patient I'm working with, we've made such great changes in nutrition and lifestyle. They're moving, they're managing their stress, they're sleeping, and they're like, okay, I'm still feeling like, despite what I'm eating, my cravings feel primal. And for some people with PCOS, because of severe insulin resistance, they literally wake up in the middle of the night like hungry. Then I say, like, let's try inositol. Like, I do think there is like such a time and place for that, along with like vitamin D, just nutrients, right? If there's a deficiency, it makes so much sense. Like our reproductive function is going to be impacted and it's going to be impaired.
But make sure you get assessed before you take supplements, guys.
Yeah. I mean, honestly, I've taken like so many wild ones growing up too. And now I'm like found my happy place. I mentioned over email, I used to have eczema. Like I do have eczema, you know, it flares up when I'm really stressed. I've tried the whole elimination. I've gone through the whole gamut. So I know how
feel
you all
you.
feel.
Yes. See, guys, Trista is also an eczema warrior. The whole supplement world is can get really crazy out there. But going back to the basics, like focus on the foundational parts of nutrition and health, which is like balanced meals, meal timing, not skipping meals. A lot of the times what we see is patients go right to the supplements. And then
Right?
they're like, and then I asked them, how's your diet? They're like, oh, it's really great. I'm like, okay, well, tell me more. And it's like they're skipping breakfast. Their meals are like 7 hours apart, but they eat really clean. Their diet's clean, but
Yeah.
it's like the meal timing and the habits that don't seem very important. It sounds silly, but it really is so important.
You can't out supplement a diet and a lifestyle that stresses your body out. No pill's gonna fix that, whether it's a supplement or a prescription, you know?
Exactly. And a lot of people don't see that their diet can actually cause physical stress on the body.
Which is why I'm like, no fasted workouts. Another myth, I'm a huge believer in restorative exercise, nervous system regulation. And that said, high intensity workouts, if you're fueling properly to recover and restore and giving your body enough of a rest after and sleeping, that's not going to harm your hormones. Just never do it fasted. Please, please, please. Like,
Mhm.
never skip breakfast and then go to a HIIT class. Yes, your cortisol is going to stay high. Yes, you're going to feel awful and jittery and then want to eat everything at 5 p.m.
I mean, I've done that before in the past, not anymore, but I don't do
We've
it.
all been there. Yeah.
Yeah, and then people will drink coffee on an empty stomach and then go do their HIIT workout.
I did a HIIT workout, I think last year, and I saw a girl literally like faint in the washroom. Eat
Yeah,
a
even if
while
it's
ago.
something in the morning, even if it's a banana,
Yeah.
just something in your body. Okay,
Mhm.
Trista, can you share one piece of evidence you want to leave the listeners with today on the show?
Okay. So, one piece of advice is if you have PCOS, it's so important to start your healing journey by connecting with your body and understanding why you want to go on this path of healing and what that looks like for you. Because I think in the wellness world, there's so many shoulds and ideals, and there's things like, yes, PCOS can absolutely put into remission. And all we talked about today can help put it in remission, but there's no reversal. Or maybe you got diagnosed and it feels like it is kind of in remission. You also don't have to go down an endless path of like trying to optimize as well, because that can burn you out and stress out your hormones. So really connect with your why, what your goals are. Is it that you want to have enough energy to go outside, enjoy your family, your friends, go on your hikes, like live your best life? Is it that you want to lose weight, or is it that your body feels stiff and you want more joint mobility and you want to be able to live your best life, essentially, right? And be really honest with yourself along the way, whether you're working with myself, another treatment, a naturopath, a doctor, a therapist, right, on what actually feels good in your gut. And that's where advocacy comes from. Because I think when your mind, your wise mind, what's going to work best for you, what feels best for you. If this quote unquote diet plan, right? That's never what I would actually call it, for my treatment plans, but if it's going to work for you, if you're going to stick with it and how your body's responding. So let go of the shoulds and really connect back to your inner voice and what is authentic to you.
I love the takeaway, reconnecting with yourself and knowing that your body knows best. It does. Yeah, it'll communicate with you in signs and symptoms. Tune into it. It can really guide you on the right direction.
Exactly.
Well, Trista, it was a pleasure having you on the show. I feel like I could talk forever, but thank you for your wealth of knowledge and sharing your expertise and everything about PCOS. If people want to learn more about you and how they can work with you, I know you have a PCOS group program. How do people find you, I guess?
So I do have a 12-week PCOS recovery program, which is based on science-backed tools, mind-body connection, and community to help people with PCOS find sustainable ways to manage their symptoms and really feel like they're taking charge of their health and their hormones. To learn more about that and connect with me, you can visit me at www.thegoodlifedietitian.com. You can also find me on Instagram. I'm quite active and I share a lot of tips at The Good Life Dietitian, where you can also find my podcast and blog for some free resources.
Perfect. And all of the links will be in the show notes. So you guys can go ahead and click the show notes to access Trista's social media and resources.
Thank you so much, Julia. That was a great chat.
Thank you for being here.